I'm going to now demonstrate the administration of subcut injections for skin exam. So before I approach my patient, I'm going to decontaminate my hands with hand gel. Fingers interlaced, back of hands with fingers interlaced, fingernails, thumbs, centre of my palms and wrists. I'm going to check that the environment is safe before I go into my patient, and I'm going to go and speak with my patient. Hello Alice, my name's Beth, I'm one of the district nurses today.
Hello.
So I've come here to give you your insulin. Is that okay?
Yes, that's fine.
So I just need to check your details before I carry on, okay?
Okay.
So can I have your full name?
Yes, it's Alice Thomas.
And your address?
It's 1 High Street Pool, BH12 4PH.
And your date of birth?
It's the 21st of April 1953.
Okay, so that matches my paperwork. And are you allergic to anything, Alice?
Yes, I'm allergic to morphine.
Okay, that's fine. So I'm giving you the insulin today, so that doesn't contain any morphine. Do you know what your blood sugar is?
Yes, I did it earlier and it was 8.6.
That's fine, so I'm happy to proceed with your insulin. And have you had your lunch already?
No, not yet, but I've got it all ready.
Okay, brilliant. So what I'll do, Alice, is I'm just going to check my paperwork and get the injection ready. Is that all right?
Yes, that's fine, thank you.
Are you comfortable here? You don't need the toilet?
No, I'm okay.
Okay. So before I assemble my items to get my injection, I'm just going to check the prescription. So patient's details I've checked, they're all correct. She's allergic to morphine, and the drug to be given is glargine. The prescription has been signed by Dr. Jones at 9 o'clock this morning, 9:20. So I'm happy to give that, and the dose is for 15 units. I've checked the patient has checked her own blood sugar, and that's within a normal range, so I'm happy to give it. So now I'm going to prepare my items for the injection. So I'm going to take my injection tray and sharp spin. The sharp spin isn't full, and I'm going to wipe it with this 70% alcohol wipes. Just make sure it's clean, and obviously I'll make sure this is washed with soap and water regularly as well. Dry my hands. And now I'm just going to get my items for my injection. So I've got here my medication, which is glargine. I can see this doesn't have any precipitates, it's the correct medication, and the expiry date is 2024, so I'm happy to use that. I'm now going to take one insulin syringe, which is clean, dry, intact, and expires 2024. I'm now going to take two of these 2% alcohol wipes, which again are clean, dry, intact, and expire 2022. I'm also going to take one small adhesive dressing, which is clean, dry, and intact, and expires 2022. I'm going to take one gauze pack just in case, which again is clean, dry, intact, expires 2023. Okay. Now I'm going to decontaminate my hands. I'm going to wear my gloves now. On my apron. So I'm going to prepare my medication here, and then I'm going to go back to my patient. So I'm going to take my 2% alcohol wipe, and I'm going to clean the neck of my medication vial for 30 seconds. 1, 2,
See, in 30 seconds is done.
Okay, and then I'm going to leave it dry for another 30 seconds. So 1, 2.
Assume that's done.
Okay. I'm now going to draw up my medication. So using a non-touch technique. My insulin syringe. Oh, so I've actually what I've done here is I forgot to open my vial before I took my syringe ready, so I'm just going to resheath that now. So don't worry if you make a mistake in your exam, you can always rectify it. So I'm now going to open my medication. If it's glass ampule, I would use a piece of gauze or the sani cloth. Presuming this is glass, I would break it like so and dispose of the cap in the sharp spin. Okay. Now I'm going to draw up my insulin. So for this time I need 15 units. I'm just removing some bubbles now. Okay. Now resheath your needle using the scooping method. Be very careful not to touch the end of the needle. I now can show my examiner that I've got 15 units of insulin. Place this back in my tray. I'm now going to gel my hands before I go back to my patient, and I'm going to grab a clean pair of gloves to take with me. Okay then, Alice. So I've got your insulin ready. I just need to carry out another ID check.
Okay.
Is that alright?
Yes, that's fine.
So could you tell me your full name, please?
Yes, it's Alice Thomas.
And your date of birth?
1 High Street Pool, BH12 4PH.
Lovely. And your date of birth as well, please?
21st of April 1953.
Okay, so my patient's details match my drug chart here. So Alice, is it okay if I do the injection in your tummy today?
Yes, that's fine. I haven't used my tummy for a while.
Okay, so obviously with subcut injections we need to remember to alternate the sites, so we can use the abdomen, the upper arms or the thighs. So this time I'm going to use the abdomen. So I'm just going to uncover you. Before I would do this, obviously I'd make sure the doors and windows are shut, those kind of things, and any relatives I would ask them to leave. Okay. So I'm just going to clean the site for your injection now, so it's a bit cold. So cleaning the site for 30 seconds in a circular manner.
Assume 30 seconds is done.
And then letting it dry for 30 seconds.
Assume that time is done.
I'm going to get ready my plaster to put on after the injection in my tray here. Okay. So pinching the skin. Because this is an insulin injection, I need to administer at 90 degrees. If it was another subcut injection, I would administer that at 45 degrees. Are you ready, Alice?
Yes, I am.
So sharp scratch. And then you putting the injection in dart-like manner, and then administering it slowly over 10 to 30 seconds. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, loosen the skin, removing it, and then I would use this device here and put it in the sharp spin, and I would apply a small plaster. Okay, you alright, Alice?
Yes, I'm fine, thank you.
Okay, so it looks fine, it's not bleeding or anything, so I'll just cover you up. Is there anything else you need me to do while I'm here?
No, I'm fine, thank you.
Okay, I'm just going to do my paperwork and tidy up my things.
Okay.
So now, disposing of all of my items in the clinical waste bin, I'm going to leave aside my injection, so my medication, so I can write down the batch number. Remove my apron and gloves and a ball. Decontaminate my hands. And now filling out my drug chart. Putting in my name on the top. Write in the batch number of my medication. So I would then store this insulin in the appropriate manner based on the instructions from the manufacturers. If that's in the fridge or outside, I would check that. So I've now completed my paperwork, just signed for the date and the time, and that's it. So I'm happy now, I'm all finished. I would just wash my tray before I use it with the next patient and put away my insulin. Okay. So that's it for this station.